It cuts across. I can even mention of Kolebu Teaching Hospital, what is a teaching hospital. I was there last week, and the issue of anesthesia machine wasn't even available, to the extent that 3 of the theaters at the main surgical departments have been shut down. And we are seeing the same thing here too. Going forward, what is the ministry going to do about it?
Okay, so retooling is government's priority area, but we are going to tackle it with a different approach because of the experiences in the past. What we've realized is that it is not sustainable for government to continue to provide equipment for health facilities across the country, because you provide the equipment, they go faulty, they become obsolete, and you have to bring another money to replace them or to fix them. It's not sustainable. That's a fact. You may disagree with me. And so, in as much as government will continue to, supply some equipment, we are going to go the PPP way. That is government direction on retooling. So anybody listening to me, if you are interested, we have directed at all, hospitals and the Director General at the Ghana Health Service must direct all PPP arrangement to the ministry. And so we are going to have proper arrangements with the private sector, so that they will have an arrangement with the facilities, they will have a proper profit sharing arrangement with the facilities, and their fees and charges will be subjected to the Fees and Charges Act. Their fees will be approved by Parliament to be part of the conditions, the criteria for choosing a private partner. So it is not as if we are privatizing the government health facilities. No. So if you come and partner government to provide such services, you will have to agree that your fees and charges must be subjected to Fees and Charges Act. In other words, it must be approved by Parliament. That's exactly what we are doing. So we're doing major, very major. We are even going to start with the dialysis very soon. We've had proposals from the private sector. We are putting them together. We will advertise, and then we will divide the whole country into the number of proposals we've gotten, and then start action.
Thank you.
Good. So we have had the opportunity to be conducted around, pick some issues from patients, issue of co-payment, people who are subscribers of the National Health Insurance, but will have to pay extra money although they are subscribers, long hours of waiting, and other issues. So we've had meetings with them. We will do what we can as a ministry, and then we've also encouraged them to do more. I think this is a unique situation. The facility was constructed by the Ministry of Roads at the time, not the Ministry of Health, but equipping the facilities was not part of the contract, and so it was not done. And so they had to struggle on their own until now, but they are not doing badly at all. So we'll do an assessment of the facility and see what we can give them as early as possible, one at a time. So we promise them, we instructed the procurement unit to immediately set the process in motion as soon as we finish assessing the place. And so I think that's the summary of what I can tell you for now. Yeah.